for 5 minutes of questions.
Mr. Chairman, thank you. I want to thank both you and Ranking Member Ruiz for calling us together again in this Select Subcommittee. I've often, as you know, Mr. Chairman, gone on the record to vocalize my support for our work on this committee on the pandemic and the aftermath, because at its very core, if we do it correctly, it will better prepare all of us for whatever comes next, and what comes next just could very well be another pandemic. So my definition of the right way is to kind of leave the theatrical politics aside and to act in a bipartisan, solution-oriented manner. Doesn't mean that we agree, doesn't mean that we're going to disagree, but at the end of the day, we've got to be driven, I think, by a real effort to peel off the theatrics and to try to get to where we, in fact, want to go. I'm glad that on several occasions today, both you, Mr. Chair, and the Governor have expressed your heartfelt condolences for these families that are left behind with empty tables to continue 4 years later dealing with the aftermath of this. I didn't really, coming on this committee, feel that there was a personal connection, except when I first heard the testimony of our colleague from California, Mr. Garcia, and how he lost both his mother and his father. Not in New York, but across the nation. These sort of stories still haunt all of us. And so that's why I think that this committee's work is almost sacred in that regard. We've got to find a way to do all that we can to get information, to build a roadmap, and to try to limit any further damage. Governor Cuomo, thank you for appearing here voluntarily today. I've got a couple of quick questions. Is it your testimony, sir, that the nursing home deaths were not caused by CMS, CDC, or DOH policies, but rather, as you state, that was in fact not the case, but you have more to say about it, and I want you to take this moment to say that, if you would.
Thank you, Congressman. This is a red herring. I understand it's sensational, and it's been great politics for 4 years, and it's a diversion from federal responsibility, which is the main goal of this committee. It's majority. But every study says that COVID got into the nursing homes from infected staff, community spread infected staff. Neighborhoods that had higher COVID infection rates had higher COVID infection rate in their nursing homes. It literally was walked in by the staff. Why? Because January, February, March, April, you have no ability to test nursing home staff. Because between the World Health Organization and CDC, they never created enough tests for the nursing home staff. So good people went home, went out to a restaurant, got the bug, they brought it to work the next day. Every study says that, and that has nothing to do with hospital admissions or readmissions.
And Governor, is it your testimony that you told your team only to release information that had been verified?
I was not going to release inaccurate information. I leave that to President Trump.
Is it also your testimony that an error in judgment was made by you because of an assumption that the CDC and CMS and other federal agencies were actually providing official guidance only to be counteracted by the GAO, which made a finding that contradicted that?
100%. If there was a mistake, it's that DOH was relying on CMS and CDC, and that was before we found out that there was political interference by the president and mass confusion in the management.
And Governor, you have taken a moment to express condolences, to offer also the fact that you were not perfect in these decisions, that I assume if you had a chance to do it all over again, there would be some different approaches to this. What do you want this committee to take from your testimony today as we juxtapose this against this history that has gone on now for 4 years?
Congressman, I think forget the politics of the 4 years and the rhetoric of the 4 years, because that's all it was. Look at the facts. How did the virus spread? This is science. This is medicine. We know what happened. We know what happens when you have no testing and no PPE and no vials. We know the science and why this country did worse than every other country on the globe.
Thank you, Mr. Chairman. I yield back.
Now recognized Dr. Miller-Meeks from Iowa for 5 minutes of questions.
Well, thank you, Mr. Chairman, and thank you, Governor Cuomo, for testifying.